Hello, this is Dr. Ragini, fertility consultant from Ferty9 Secunderabad branch. Now I would like to discuss about the most common asked doubt, that is should there be any precautions to be taken in the first 3 months post IVF conception. In the sense people have conceived with IVF and now they are worried about how will the pregnancy go. So not to worry much, just like how you were pre-pregnancy, post-pregnancy after IVF, we will ask you to have a very frequent checkups. First checkup will be once the beta HCG is positive, we will check for how is the doubling of beta HCG. Like after every 48 hours, there should be a doubling of the value. Then we will anticipate that the pregnancy is going healthy and the pregnancy is being safe. If there is no doubling or the first beta HCG value is less, then we will be little very keen to know frequent visits to be known within the first week. Like if the doubling is good, we will ask them to come after 1 week to get a scan. To check for how is the pregnancy sac. Okay, where is the pregnancy sac? What is the location of the sac? The sac normally should be present within the uterine cavity. If at all, if the sac is not seen in the uterine cavity, then we will check for the sac, where is it located, whether it is in the tubes or whether it is in the ovary or elsewhere. Okay, that is called pregnancy of unknown location. So once we know correctly that the sac is present inside the uterine cavity, then it is a sure sign that it has come to the right position and now it is growing. Now the repeated scan is done to check after 1 week, after 7 days, that how is the sac growing? Is it growing well? Is there a development of the yolk sac? Is there a development of the fetal pole? After that, is there a formation of the heartbeat? So all these are stepwise findings which we see on scan post conception. In case once the beta HCG is positive but the values are not very good, then we will ask for doubling, and the doubling is not very good, we will ask for a very frequent scans just to know how is the sac. Where is the sac? Sometimes, very few times, when the doubling is not good or the value is not very proper, then we will anticipate that sometimes the sac is not growing inside the cavity. So all in those patients, the frequent every 2-3 days we call them to know and locate the gestational sac. Okay. These are the two categories people. Now once the sac is proper and the cardiac activity is seen, then we will also look for mostly in IVF conception how many sacs are seen. Okay, like sometimes the twins are most common in IVF, we all know that, because we are putting more embryos, the chances of implantation is higher. So chances of twin gestation is high in IVF pregnancy. That also we will look for in the early pregnancy scans. Once the scan part is over, once the cardiac beat has come, we will ask them to get a routine antenatal checkup. Okay, antenatal profile, blood picture, like is there any thyroid which has developed, or what is the blood group, how is the blood percentage, hemoglobin percentage, and if any necessary things we will correct with the medication. Now they will ask most common, ma'am, what type of precautions should we take while doing all this? Basically, no need to take any extra precautions. Once the pregnancy has come, it is as similar to as a natural pregnancy, just that the frequency of visits are more initially. Once everything is settled and everything is all normal, then the frequency will be similar to the natural pregnancy patients. And they also require a very frequent or monthly BP and blood pressure and weight checkup also, to know about is there any rise in the blood pressure in the IVF pregnancies, because little chance for pregnancy induced hypertension and pregnancy induced diabetes is most common in IVF pregnancy than in natural pregnancies, but these are very much under correctable conditions. Okay. And there is so much of myth in many people that we have to take a prolonged bed rest and all that, but that's a pure myth. There is no need to take an extra precautions while undergoing any of these visits to the hospital or at home. You can do your routine physical activity, you can do your routine walking, and the diet will be the normal diet, but the sugars or sweets should be decreased in the diet. The carbohydrate content should also be limited, because the tendency of getting any other diabetes will be little higher, but otherwise healthy, nutritive, protein rich diet is always advised with lot of vegetables. And next, coming to the how should we withhold our office work? It's not at all necessary. You can do along with your office work also, and there is no need to take any kind of bed rest. Always we advise many a times to undergo do some walking and have a healthy exercises also. Minimal ambulation is always necessary apart from taking medication. Okay. And after around 11 to 13 weeks, we advise for NT scan, that is first trimester scan. First trimester scan is very important, because to rule out any of the aneuploidies or most common Downs, adverse Patau's, any of these are more common, we can find out in the NT scans. Later, most important is the TIFA scan, that is the anomaly scan, to look for any of the anomalies in the fetus and how is the growth in the fetus. And post that, the checkups will be little more frequent after 7 to 8 months to check for again BP and the blood sugars, and then once everything is fine, we can advise their delivery. The delivery is not mandatory to go with cesarean section always. It depends upon the obstetric condition. Okay. The obstetrician can take a call on how is the delivery, not necessarily that all the IVF pregnancy should undergo a cesarean section. Okay. Throughout the 9 months journey, it is better to have a healthy lifestyle with no complete bed rest is required. That was a big myth which all the IVF patients will be having. So, any queries on this, please do come and get it clarified or comment below. Thank you.